Hi, my name is Dr. Caroline Mithi, an internal medicine physician and endocrinologist. Today we talk about the overview of the thyroid gland and thyroid hormones. The thyroid gland is a small organ that sits in front of your neck. It's a butterfly-shaped organ that just sits around here. And this small gland is very important in that it produces thyroid hormones. These thyroid hormones basically help with each and every function of our body. From the heart, it helps with the heart beating, from the gut, for our gut to move, for the skin, for the eyes. So basically each and every part of the body uses the thyroid hormone. So the thyroid gland can produce these hormones in low amounts than should be, that is called hypothyroidism, or in high amounts, which is called hyperthyroidism. And we'll discuss about these two conditions in detail in the subsequent videos. You may have excessive fatigue or constipation. You may have a bit of depression if you have hypothyroidism, meaning the thyroid hormones are produced in low amounts. But in the other way, if the thyroid gland is producing excessive hormones, what we call hyperthyroidism, then everything will be overactive. So you'll have tremors, you'll have palpitations, you can have diarrhea, irregular menses, weight loss that is unexplained. So those are some of the symptoms of hyperthyroidism. How to diagnose these disorders? You'd have to have a blood test done to check for the thyroid hormones, and there are certain ranges that we look for. The other thing, if your thyroid gland is enlarged or what we call a goiter, then we'd have to do an ultrasound to check for the sizes and check if you have other swellings within, what we call nodules. Thyroid gland disorders are treatable depending on either hypo or hyperthyroidism, and this is basically medication that you'd take. But for hyperthyroidism, then there are other modalities, and we're going to talk about them in the subsequent videos. A key to note, there is no nutrition that can treat hypo or hyperthyroidism. You'd have to take medication for that or other treatment modalities. However, there are certain lifestyle things that you can do if living with these conditions. The key is exercise. Basically, because hypothyroidism, you'd have increased in weight, so exercise will help your weight be in check. But remember, this is not treatment. These are just supportive parameters that you'd use. So join me as we delve in the intricacies of hypo and hyperthyroidism in the subsequent videos and how thyroid gland disorders affect women's health. So thank you and see you next time.